families are faced with enormous complexity of issues as one dominoes onto the other. What I've seen in children and families in the neighborhoods where I work are tremendous courage, tremendous tenacity, determination to make a better life for their children. Oftentimes, they don't see that life available to them because the barriers are so great.
Well, the incomes are vastly different in Texas. And when you look at our non-Anglo populations, African Americans, Hispanics, for example, the average household, African American or Hispanic household, makes only about 2/3 of what the incomes are for Anglos. And poverty rates for African Americans and Hispanics are roughly 3 times as high as those for Anglos.
Poverty is about income. We need to see how we can help families through higher education, through job training, increase their income so they can take care of their own children, so they can take care of their families.
Children can be gifted and talented. They just might be in poverty. But that poverty can erode all their gifts and talents. If you have a toothache or you don't have shoes, well, kind of hard to showcase any gifts or talent if you're just embarrassed to even show up.
We spend less on providing our social worker with an adequate salary and a good place to work than we do for teachers, for example, and that we do in most other states for social workers. So we have a situation where we don't have enough social workers. We have something like 25 to 30% turnover with social workers, even higher with social workers who are in the investigation area. And yet we have more and more children that need their help and need their intervention.
I was put into Child Protective Service when I was 15. My first caseworker, she was real good at her job. She would always come every month, visit me, make sure I was doing good. And then towards later on, the caseworkers, I understand that caseworkers have a lot of caseloads, but the child still needs a visit from a caseworker to hear where she's coming from, to learn if she's changing or if she's doing good or if she's doing worse. And I had a lot of problem with that because my caseworkers wouldn't come visit me.
Foster families today are reimbursed at about 80% of their costs. So that means private individual families are funding the state of Texas 20% of the cost of taking care of children who the state is responsible for. I think that's unconscionable. These families have opened their homes to these children, and we owe it to them to support them with all the community resources that we can muster. I think if they were fully reimbursed, that more families could afford to step forward.
I was 17 when I was in the foster home with 8 girls, and at that time the budget was cut and my foster mom had to cut low on buying us clothes. When they cut it, it was a surprise because I'd figure if they want to help us, they'd pay more instead of pay less.
We are well underfunded, primarily, and if you look at numbers, and it's hard to equate these children with numbers, but if you compare Texas, for example, with other states, we spend less on each child as far as prevention of abuse and neglect than virtually any other state.
It seems that every cut affects all of our children first, and that has been the pattern continuously. We really need a different initiative. We need an initiative that puts children first.
We, of course, also have the highest rate of uninsured and the highest number of uninsured of any state in the country. And in many cases, those are full-time working people. These are people who are working in a relatively low wage, perhaps a minimum wage job, and simply cannot afford health insurance.
A couple of things happen when children do not have insurance. we try to keep the kids on a regular schedule of well child visits. And when they come in regularly for their well child visits, we're able to pick up any developmental delays, any language problems, and head problems off before they get out of hand.
If children are not covered, parents delay accessing care, and then children are sicker when they do need care, and they often show up then at the emergency room, and that's much more expensive care, not only for the parents to pay for, but for the community to pick up.
The other thing that happens when children use the emergency room as their primary care home is that the care is fragmented. So one doctor will see them one time, a different doctor will see them the next time, and if they do have an ongoing problem, it may not be as diagnosed as quickly, or follow-up won't be done as efficiently.
What we have been able to show is that children with health insurance have an increase in well child checkups because they have that access to the health insurance. And that's part of what, if you've never had health insurance and now you do, you learn to use it and you learn to access the appropriate care for your kids. But these aren't families who don't want to meet their obligations and take care of their children, and they pay taxes just like we do, and they just want access to a good, solid health insurance program.
If the well-being of the children, the mental health of the children is not there yet, if they need help, no matter how well we provide on the facility, on the nutrition program, that is a fundamental area we need to really address, okay? So I'm hoping that we will put the mental health issue at the top of the agenda.
The brain of a child is growing like crazy, and you can mold it and change it and shape it and guide it, in 1,000 different ways. And if damage is done at a certain stage, damage is done. And it will have long-lasting impact, if not for the rest of their lives.
The graduation rates, I think, it was something that really stuck out with me, that we rank 50th. In terms of 50 states, we actually rank 50th in terms of adult graduation rates. The educational level is so important in terms of, will our adults make more than minimum wage? Will our children graduating be able to have a life better than what their parents had?
It's also the key to the future of Texas in many ways, because education is the single best predictor of income. Hispanics have shown some improvement in the 1990s, but still fell far behind that for either African Americans or Anglos. And African American rates, of course, were also lower than those for Anglos.
Because we have very low licensing standards, many times we have individuals and teachers who work with young children who have very poor skills themselves. The person who does your fingernails has to have more training and more of a licensure than the person who cares for your most precious resource and your most precious treasure, your child. And because the child care industry is such a low-paying industry and it's not very profitable, many child care programs just get by with the minimum. And when I say the minimum, they meet the minimum licensing standards, they have the minimum staff, they have the minimum resources, and all of those things are really important to a child's well-being.
When we talk about quality care, oftentimes we look at, is the center well-equipped? Okay, yes. Not just equipped with the hardware. How about the software part? Our teachers, are they equipped with knowledge to know the developmental stages of the children? Are they knowledgeable enough to identify their needs?
We need high-quality people, but it's difficult for us to get high-quality people and pay them $5.50 an hour, when at a local barbecue place they can get $8.50 an hour and free educational benefits. I realize it's a competitive marketplace, But the state has got to step up and say these children are important to us. They are our future, and we need to provide them people who are capable of caring for them and understanding the treatment modalities and the policies that are required to care for them successfully. Prevention is far cheaper than trying to take a child into the emergency shelter and then into the foster care system. And we know nationally that if a child is in the child welfare system, they have a 50% chance of being in the juvenile justice system eventually. We are a feeder system to the juvenile justice system. That's a condemning statistic. So if we could prevent the child from even entering the child welfare system, we could greatly reduce the costs of the child welfare system and the juvenile justice system.
Early detection, early intervention is pennies compared to the dollars that it takes to treat at the tail end as these children get older.
If we don't address these problems when these children are children and when they can get an education and when they can become good citizens, we lose them to prisons, to MHMR facilities, and to broken homes.
Once the tragedies occur, we're stuck with them, and they're very costly, and there's relatively little that we can do to make them really that much better. But when you find these problems early and you have a system that can intervene quickly and early, and when you have the tools and the resources to prevent some of these issues from happening in the first place, then we're in business. Then you're going to see the statistics change dramatically.
Economic development really depends upon the future of those who will come later. Those are our young people, and they need to have better skills, better education, better health care, a better life, all in all, to be more productive in their adulthood. We can help by helping young people.
I think the cause around children is one of the most important and most significant investments that anyone can make, especially business leaders, because we truly do have a big impact on the way things occur in the state of Texas. And by us standing up and speaking out on behalf of children, I think it lets individuals know that this is important not only to families and to community organizations, but also ultimately to businesses that are going to drive Texas into the years ahead.
Texas doesn't have a future if our children don't have a future. That's our future workforce, that's our future moms and dads, that's our future citizens, that's our future volunteers, that's our future. And Texas will not have a bright future if we don't address the needs of our children and make them our priority.
I don't think I've met a child in the children's shelter, and I've seen, I think, over 25,000 children that with just a little help wouldn't be just fine. They want to do good. They want to learn. They're eager. And if we can just reach out and help them, we could do away with an awful lot of the bad things that happen in our communities.
And that's what it's really all about. If we don't start working and helping people when they're young and getting them through this spot, even if they are impoverished and their parents don't have very much, then we're going to perpetuate the cycle. And they won't do well in school if they're not well.
I'm a master gardener, and you can attempt to grow any plant you want to, but if you put it in bad soil, it's not growing. Children are the same way. They grow because of the resources that surround them when they're trying to grow. If we don't have parks, if we don't have after-school programs, if we don't have supportive services for those that need a little more help, they're not going to grow real well. We need a foundation of support for children in our communities so that every child, regardless of their interests, can find something to grow with.
There's no better place to live than the state of Texas. We have worked diligently in our communities to find solutions that will be cost-effective, that will not burden our taxpayers, that will not burden our citizens, but will grant them the quality of life that they need in communities. We cannot leave our children and families behind as we move forward into a new economy, into the globalization age. We have got to look at all of the issues facing them and provide comprehensive services to meet those needs.
We should focus more on children and their needs. I think if we did, can you imagine what kind of a say we would have then? It would really be something.